Hi, I'm Dr. Rajani, and today I'm talking the lip flip. I had a lot of questions on the lip flip. Still, what is it and what are my options? One of the reasons a lot of people aren't sure what their options or what they should do is there are different things you can do. And I'm going to summarize the best, most common options that are obtainable to most people in today's video. I'm going to show video footage of each one being done. We'll show some before and afters. And that will give people an idea, because although there's a lot of lip flip videos, people are like, what's right for me? My physician doesn't offer that. So let's go through it a little more in detail today. You can watch it being done. We're all a little different with proportions, with goals, and our history of what we've had done and what we're comfortable even doing to our own bodies for a look. Let's get to this video. 3 seconds. Okay, so the lip flip. We know there's new products coming to market for lip fillers. We know there's a lot of interest in different type of somewhat off-the-wall procedures for lips like PDO Threads. And you hear people talk about, say, PDO Threads, and you'll hear on Instagram Lives, I've heard some people bashing them for the lips. But understand, unless you go to someone who's doing these procedures regularly, a lot of people think the PDO threads are used in the body of the lip. So when you hear of a procedure, the PDO lip or PDO lip flip, it's where the procedure or where the product's being placed in the lip. It's not a one size fits all. And a lot of this is the artistry of the person doing it. So a procedure by one person isn't the same as another. And it's hard for, I think, as patients to understand why everything's so different. Why can't it just be the same and one size fits all? But understanding that people have different projections, chin, nose, lip projections, and the downturn of the mouth. And until we understand all those angles, no one can tell you what you should do for your projection, your goals, and your mindset. One good video to watch that I did was get angles, get facial angles, and get famous. That takes you through a star, a movie star, their great angles, and what makes them beautiful. We cover a little bit about lip there. Let's get to the lip flip right now. So one of the most common, one of the most obtainable procedures is a lip flip with Botox. The understanding there's different Botox-like products like Dysport, Xeomin, now jeuveau. So there's different options out there, and a great video to watch for that would be my comparison of them all. And I go through how much active product is in each one. But different providers will have ones that they like based on typically the amount of product that they use, so they get it at a better price, and oftentimes they'll pass it along to you. It's a very competitive market, but using neuromodulator around the lip stops and slows down that muscle that purses, or what we call the orbicularis oris muscle. Around the mouth, the muscle purses. It's also what causes those pesky lip lines. But when you treat it, you can get a flip of the lip, a more projection. Now, nothing comes without consequences. And those of you, I know already, you're going to say, I had it done and I couldn't move and I couldn't say certain words and I couldn't talk right. Probably for 7 to 10 days. That means the dose was too high. Maybe the provider's like, hey, I better really give a good treatment. This person seems a little higher maintenance, and if they don't feel it or see it, they'll think they wasted their money. The reality is here, it's small dose. You're talking about, my average for people is 6 units around the lip. It's not that expensive. Now, not everyone can do it. Why they need the filler? Some people are going to have loss of volume. Some people aren't going to have a projection that's going to lend itself to the Botox working, and your provider will let you know on that. It's very commonly done, but it's not FDA approved. So a lot of times teaching for this is off-label, what we say, or people learn in forms outside of from the specific companies. So understanding that. So Botox, 6 units, Dysport, Zeum, and Jeuveau. They'll all work well. Watch my other videos to see which one, but it's the quickest, probably most cost-effective way if your provider thinks it's right for you. Now, all these can be combined. Let's go through 2 more. Okay, we're down to now filler, of course. We'll do a third one, but the filler is probably the second most common and obtainable. I say obtainable because not all treatments are obtainable in all countries, nor do all providers know how to do something like PDO Threads or choose to do them. So the filler, there's a new filler coming out, Wrestle and Kiss. Watch my whole video on that because it's going to show different methods of doing filler. And when using different methods, you can get different flips of the lip. And remember, one of the all-important points is that GK point in the center where the tubercles meet the vermilion. And that's one of the amazing points to give projection, but also the filter column. I have a whole video on the lip flip, but filler works well, it's obtainable, it can give plumping as well as the lip flip. And of course, when doing filler, one of the most important things to consider, and you'll see it in my video on the Wrestle and Kiss, is going to be chin projection, nose projection, and the downturn of the mouth. How can anyone fill the body of the lip without thinking about, when you get volume, about how the mouth turns down? And if it does, plumping a lip with a downturned mouth, oral commissure, people call it marionette, I hate that word, but if people want to call that a nice new lip on what is an aging feature, just isn't going to look well. So I go through that in 3D imaging on my 3D lip filler technique. You can watch more there. So we have our Botox, like products, we have our filler that can do it. That's the next step up. Let's go to the PDO Threads and talk about that. Okay, so PDO Threads, we've done a video on the nose, but also the lip flip. You can watch those both. Though they're similar in that the PDO thread is used for shaping. I don't use or like to use PDO threads in the body of the lip. I use them more in the vermilion. So it's not like you're using a lot of threads. A nose might be 12, say, where the lip in total might be 4 to 8 threads. A lot of times 4 is all you need, depending on the size. For some companies, smaller threads, they'll be a little too small in diameter to give a significant result. So some of the companies will make a thread that's small, meaning short, but actually has good diameter. So a 29 gauge, 27 gauge would be bigger, 23 gauge even bigger. As you go bigger, remember, if you don't like a thread, you can't just dissolve it like a filler. So with the thread, I use them at the vermilion border, and by placing the thread along that area where the white or the ergotrit is, and the vermilion, meaning the red, some people call it the white roll, you can get a nice flip. You do not have the risk of occlusion with that product because the thread's not going to go in and stop blood supply with a vessel. Whereas a filler, you have that added risk. The downside is, with a filler, you can dissolve it and it's gone typically within hours. So understanding with longevity too, everyone wants, can it last long? And if it lasts long and you don't like it, you're kind of stuck. If it lasts long and you love it, you love it. So longevity, there's a sweet spot. In general for threads, PDO threads, I'm going to do in ascending order of longevity. So the least long is going to be PDO threads. The next in terms of longevity will be probably PCL, polycaprolactone, which is a common one here. And equal to that, but a little longer, is going to be PLLA, polyl-lactic acid, more towards 1 to 2 years. PDO on the other end are going to, the thread's gone at about 2 to 3 months. The collagen lasts for say 6 to 8 months here because we're using a lower dose. And when you go to PCL, think more between 6 months to 12 to 18, kind of right in the middle. Different countries are going to use more of one type versus another. Different providers choose different ones. Remember, and watch my video on choosing threads because not all threads are equal. The ones you choose, and so many patients and providers don't even know what threads they're using or don't pay attention to the importance of the company they get it from, the sterility, if it's being made. So my message to everyone is, a thread isn't a thread isn't a thread, and I have a quick clip all on that. So the lip flip, the three most common ones, neuromodulators like Botox, the next would be fillers. We have a new one, Restylane Kiss, that just came to market as of this filming, and then PDO Threads are all great ways to give a lip flip. I want to hear in the comments, what do you like for your lip flip? What would you like to see us do videos on? Have you had problems with lip flips, or do you just not like when your lip is flipped? And what are your dimensions that make you feel that way? Remember, subscribe to the videos, click the bell if you like them, and join here to keep your skin and body beautiful, healthy, and vibrant.